Diabetic introduction. Diabetes is a metabolic disorder characterized by elevated levels of blood sugar due to the body's inability to produce or utilize insulin. Type 1 diabetes and type 2 diabetes are the two main types of diabetes. Classification. Type 1 diabetes, also called insulin-dependent diabetes, occurs when the insulin-producing cells in the pancreas are destroyed, resulting in an insufficient supply of insulin. In type 2 diabetes, also known as non-insulin dependent diabetes, the body's cells become less responsive to insulin as a result of insulin resistance. Approximately 463 million people worldwide suffer from diabetes, which is a global health concern. As diabetes prevalence increases, an estimated 700 million people will have diabetes by 2045. The risk factors for type 1 diabetes include genetic predispositions, autoimmune disorders, and viral infections. There are various risk factors associated with type 2 diabetes. These are obesity, sedentary lifestyles, family histories of diabetes, and ethnicity. In the pathophysiology of diabetes, insulin is a hormone produced by the pancreas that regulates blood glucose levels. In type 1 diabetes, the immune system attacks and destroys the insulin-producing cells in the pancreas, resulting in an insufficient supply of insulin. In type 2 diabetes, the body's cells become less responsive to insulin, resulting in insulin resistance. Eventually, this can lead to pancreatic exhaustion and decreased insulin production as the pancreas produces more insulin. This section discusses the various diagnostic tests used to diagnose diabetes. Fasting blood glucose. This is a simple blood test that measures glucose levels in the blood following a fast. It is confirmed that a person has diabetes if the fasting blood sugar level is equal to or greater than 126 milligrams per deciliter on two separate occasions. OGTT, oral glucose tolerance test. This test involves drinking a glucose solution and measuring blood glucose levels at different intervals. In order to confirm a diagnosis of diabetes, the blood glucose level must be equal to or greater than 200 milligrams per deciliter 2 hours after the glucose solution has been consumed. HbA1c, glycosylated hemoglobin test. The HbA1c test measures the average blood glucose levels over the past 2 to 3 months. If the HbA1c level is equal to or greater than 6.5%, diabetes is confirmed. The diagnostic criteria for different populations may vary based on age, ethnicity, and comorbidities, and different diagnostic tests may be used in different populations. As a result, it is imperative to consult the current diagnostic guidelines before making a diagnosis of diabetes. Here are some of the short-term and long-term complications associated with diabetes. A hypoglycemic state is characterized by a low blood glucose level and is a short-term complication of diabetes. There are a number of symptoms associated with hypoglycemia, including sweating, shakiness, confusion, and loss of consciousness. It is possible to develop hypoglycemia by taking too much insulin or medication, skipping meals, or performing excessive physical activity. A hyperglycemic state is characterized by high levels of blood glucose in the body. The most common symptoms of hyperglycemia are thirst, frequent urination, and blurry vision. It is possible to develop hyperglycemia by consuming too many carbohydrates, taking insufficient insulin or medication, or engaging in inactive activity. Diabetes ketoacidosis, DKA, is a potentially life-threatening complication of type 1 diabetes. DKA occurs when high levels of ketones, acidic byproducts of fat metabolism, are produced by the body. There are several signs and symptoms of DKA, including excessive thirst, frequent urination, nausea, vomiting, abdominal pain, and a fruity odor to the breath. Diabetes is a major risk factor for cardiovascular disease, including heart attacks, strokes, and peripheral arterial disease. A high blood glucose level can damage blood vessels, resulting in atherosclerosis, the narrowing of arteries. Diabetic neuropathy is a long-term complication of diabetes that affects the nerves, causing tingling, numbness, and pain in the hands and feet. It is also possible for neuropathy to cause digestive problems, such as nausea, vomiting, and constipation. Diabetes nephropathy results in damage to and failure of the kidneys as a long-term complication of diabetes. The most common symptoms of nephropathy are fatigue, swelling in the legs and feet, and a reduction in urine output. In diabetes, retinopathy is a long-term complication that affects the eyes, resulting in damage to the retina's blood vessels. A person with retinopathy may experience blurry vision, floaters, and eventually become blind. The problem of foot problems is a long-term complication of diabetes, which results in poor circulation and nerve damage. Ulcers, infections, and amputations are some of the most common foot problems. The following are various approaches to managing diabetes. Modifying your lifestyle is an essential part of managing diabetes. It is important to engage in regular physical activity, maintain a healthy weight, and consume a diet that is low in carbohydrates and saturated fats. In addition to improving blood glucose control, lifestyle modifications may help reduce the risk of long-term complications. An oral hypoglycemic agent reduces blood glucose levels by lowering blood sugar levels. Some of these medications include metformin, sulfonylureas, meglitinides, and inhibitors of DPP-4. The use of oral or taken through the mouth hypoglycemic agents is commonly used in the treatment of type 2 diabetes. Using insulin therapy to regulate blood glucose levels is a form of treatment for diabetes. Both type 1 and type 2 diabetes can be managed with insulin therapy. Insulin comes in a variety of forms, including rapid-acting, short-acting, intermediate-acting, and long-acting. The monitoring of blood glucose levels is an essential part of managing diabetes. In order to improve blood glucose control, individuals with diabetes can self-monitor their blood glucose levels using a glucose meter. It is important to note that diabetes management is a personalized process, and treatment plans will vary depending on an individual's age, comorbidities, and other factors. In order to effectively manage diabetes, the individual with diabetes and their healthcare team should collaborate.
Diabetes prevention strategies include: an important factor in preventing diabetes is maintaining a healthy weight. There's a strong link between obesity and type 2 diabetes. It is possible to reduce the risk of developing diabetes by maintaining a healthy weight through regular physical activity and a balanced diet. Taking part in regular physical activity is another important factor in preventing diabetes. As a result of physical activity, insulin sensitivity is improved, which can assist in lowering blood glucose levels. It is recommended that adults engage in at least 150 minutes of moderate intensity aerobic activity per week. It is important to consume a balanced diet that is low in saturated fats and high in fiber in order to prevent diabetes. Consumption of fruits, vegetables, whole grains, lean proteins, and healthy fats can help control blood glucose levels and reduce the risk of diabetes. Diabetic prediabetes is characterized by elevated blood glucose levels, but not high enough to be classified as diabetes. Prediabetic individuals are at an increased risk of developing diabetes. People can reduce their risk of developing diabetes by screening for prediabetes and making lifestyle modifications, such as engaging in physical activity and following a healthy diet. In order to prevent diabetes, it is recommended that you refrain from using tobacco. Diabetes management in special populations. Women who are pregnant and have diabetes require special management to ensure a healthy pregnancy and delivery. It is recommended that women with pre-existing diabetes receive preconception counseling and closely manage their blood glucose levels throughout pregnancy in order to prevent complications for both mother and child. In order to prevent adverse outcomes, gestational diabetes, which develops during pregnancy, must also be carefully managed.
In light of their increased risk of complications and comorbidities, elderly patients with diabetes require special consideration. The treatment goals should be tailored to the patient's age, comorbidities, and functional status. In the elderly, hypoglycemia may be a greater risk and patients may need to be monitored more frequently. Patients with comorbidities. Patients with diabetes and comorbid conditions, such as cardiovascular disease, renal disease, or depression, require a special approach to diabetes management. An individualized treatment plan should be developed based on a patient's comorbidities and overall health. The management of diabetes should be integrated with the management of comorbidities in order to prevent complications. Patients with cognitive impairments, such as dementia, may have difficulty managing their diabetes. It may be necessary to involve caregivers and simplify medication regimens in order to ensure effective diabetes management. Lack of resources or support may make it difficult for patients with limited access to healthcare to manage their diabetes. Patients can benefit from the assistance of healthcare professionals by receiving education and resources to support self-management as well as by being connected with community resources. The benefits of diabetes education and support. By providing patients with the knowledge and skills necessary to manage their diabetes effectively, diabetes education can improve patients' self-management skills. Among the topics that can be covered in education are monitoring blood glucose levels, medication management, nutrition, physical activity, and self-care. Living with diabetes can be challenging, and patients may experience stress, anxiety, and depression as a result. A diabetes education program can assist patients with managing the emotional aspects of their disease, including stress management and problem-solving skills. Patients with diabetes may find peer support to be a valuable source of emotional and practical support. Through diabetes education programs, patients can connect with others who have diabetes, share their experiences, and offer mutual support to one another. Diabetes education and support have been proven to improve health outcomes for patients with diabetes, including improved blood glucose control, reduced risk of complications, and improved quality of life. Family members can play a crucial role in supporting patients with diabetes. Educating family members about diabetes can help them better understand the condition and how they can support the management of their loved one's diabetes. Listed below are some emerging areas in diabetes research. As genetics and molecular biology advances, there is a growing interest in personalized medicine for diabetes. It involves identifying individual differences in genetic and metabolic factors that may influence diabetes risk and treatment response. It is possible to tailor treatment plans based on a patient's genetic profile, disease progression, and response to treatment through a personalized medicine approach. A stem cell therapy could hold great promise for treating diabetes by replacing damaged or dysfunctional pancreatic beta cells that produce insulin. Research is being conducted to develop insulin-producing cells that can be transplanted into the body using stem cells. Clinical trials are currently underway to assess the safety and effectiveness of stem cell therapy for diabetes, which has shown promising results in preclinical studies.